Hi, I'm James Riedy. This is my final proposal for the dissertation on effects of action selection on reaching. As many researchers in the motor control world know, cognitive motor function and the process of action selection is a common way of studying reaction time, as well as movement time and effects on dorsal premotor tracts. So in my dissertation, I am looking at action selection, which is the process of just selecting an action, a choice, performing a set of reaches with a choice, reach either right or left, and then seeing the effects on the kinematics and the physics of hand path ratios, acceleration, velocity, movement time, reaction time, response time. So, my hypothesis is that young, healthy adults under action selection demands, there will be a larger increase in reaction times and greater engagement, therefore, of bilateral dorsal premotor tracts compared to young healthies who do not have the action selection demand. They are just execution only for their reaches. So, planning demands will not impact reach performance, or planning demands will affect reach performance. Past research has looked at the premotor dorsal tract and the entire cortex as an important neural correlate of visually guided reaches. But action selection specifically calls upon dorsal premotor tracts because internal models of motor planning are required under action selection conditions. So, visual stimuli and information on target location, as well as the importance of speed and accuracy for a visually guided reach, are important and salient information for action selection research. And this research can then help baseball players be more accurate with their training, perhaps even prevent injury. Might help them post-injury in recovery of premotor dysfunction or lesions, which then leads to a Parkinson's or stroke or cardiovascular disease, especially ischemic stroke when we can have lesions in the premotor tract. Then understanding how visual information and action selection changes the neural correlates of reaching tasks. This can then help physical therapists design rehab programs for ischemic stroke patients and others that present very similarly, return to everyday activities such as cooking, dressing themselves, driving, because reach to grasp or reaching actions or tasks are inherent to our everyday activity in life. Digging into the methodology, 60 participants recruited from the University, Concordia St. Paul, using departmental newsletter, word of mouth. They'll be 18 years or older, college students, right-hand dominant as determined by the Edinburgh Handedness Questionnaire. They cannot have any current pain in their upper extremity. We chose the number 60. It will provide us with 75% power, and also 30 participants who are right-hand dominant can perform the task with their dominant right arm, and 30 participants who are right-hand dominant can use their left arm for the task. So we have a non-dominant and a dominant component. All the participants will be required to provide written consent, informed consent through the IRB at Concordia. The task will be completed in isolated environment. There are two targets, a red sphere to the right, a red sphere to the left. They are 5 centimeters in diameter. They're both positioned 14 centimeters away from the home position. The home position is the participants seated in a chair, the same chair for all participants, hands out in front of them on a table on a smooth surface, so 14 inches from where their hands are at the home position. So each participant must start at the same home position that is marked on the table. 45-degree angle reaching right, 45-degree angle reaching left, so we can keep it isolated and similar. Visual cues just for the execution or just for the action selection, not for the execution only group. So just for action selection group, there are two shapes to provide visual cueing. Be on a monitor, flashed up on a screen, a large green sphere, which is a reach to the right, and a large red cube, reach to left. They can choose whichever hand they want to. So they can reach right with their left hand, they can reach right with their right hand, they can reach left with their right hand, they can reach left with their left hand. They decide. That is the choice. That is the action selection. And then whatever the cue flashes up, if it's a large green sphere, that determines a right. Large red cube, reach to the left. So each trial will begin with the participants with their hands fixed at that home position. The reach targets are continuously represented throughout the trial so that only the visual cues initiate movement, nothing else. It's not verbal. They are given visual feedback throughout the entire task on the moving arm because they can see their arm. It's not in like a darkened room. They can see. All of these procedures or similar procedures have been verified previously. It will be a single collection, single session for the participants, but they do have a chance to practice or learn at least the environment and the target locations. So 4 practice trials so that they're allowed to familiarize themselves with the task and the cues. And then they complete 4 blocks of trials, and there are 8 reaches per trial. So altogether, there'll be 32 reaches. This is just for the action selection. They're given the cue to, or given the instruction to reach to the target as quickly and accurately as possible, because that will determine our piece for hand path ratio, movement time, action selection, effects on reaction time and response time. For execution only, so now this is the control, the execution only participants will just reach to the corresponding target using a pre-selected hand. So all of these folks are right hand dominant, but the folks who are execution only and in the right arm group, they will reach with their right hand. The execution only folks who are in the left hand group will reach left. That's why we had to have 60, so we could have 15 right in the execution only, 15 left in the execution only, and then have 30 for the action selection, then to keep the statistics matching. And that's the end of my proposal. You can see some visual aids at the very bottom, and then my face is kind of covering the references, but there's a QR code at the bottom. Thank you.